All right, I think we're going to go ahead and get started since we have quite a few people on the line. Good morning, good afternoon, good evening. My name is Ellen Thompson. I'm the chair of the System Strengthening Working Group. I'm really excited about today's webinar. It's actually a repeat of a presentation that we had and update on a presentation that we had back at the general management meeting in Nepal in March, but since you know, it was during a parallel session, we thought we would repeat it for a broader swath of folks to join. And so, and this is coming out of our data analytics and visibility work stream. And our leaders there thought that this would be a great opportunity to hear a little bit more about this topic. So impact teams, I'm going to turn it over to Barbara, Senior Lamphere, a Senior Technical Advisor from John Snow Incorporated, and she can introduce the rest of her, of the speaker team, and to take it from here. Over to you, Barbara.
Thanks, Ellen, and welcome everybody. And welcome to today's webinar on Impact Team Approach to Supply Chain Management. We hope you will enjoy the discussion that we're going to have. First, just to introduce ourselves briefly to you, I'm Barbara Lamphere. I've been working for the past 30 years building organizational individual capacity in supply chain management. Teshme? I'm going to get my colleagues to introduce themselves. Okay, Teshme in Ethiopia, please unmute yourself. Great. Teshme, please go ahead and introduce yourself.
Okay, good morning, good afternoon, everybody. My name is Teshome, working for GSI Project Ethiopia. I'm a senior advisor for data use. I've been working for the design implementation of information systems in Ethiopia for the last 10 years as applied to supply chain system. So everybody welcome.
Matiko?
Thanks, Barbara, and I'm Matiko Machage, team lead for InSupply Health Tanzania. I've been working with public health supply chain for quite a while here, strengthening the system and currently focusing on data use for supply chain performance improvement. And I have passion with UAVs, especially integrating UAVs and last mile delivery of health commodities. But today, of course, we'll be discussing impact team, and welcome to this.
Great, great. So I'm going to give you a little background about impact teams. So impact teams are people-centered, a people-centered data-driven approach to improving health product availability by using empowered teams to use data and to problem solve and to action plan to improve the supply chain performance. We're going to share our experiences with impact teams in Ethiopia, Kenya, Tanzania, Indonesia, and Myanmar. But first, let's go over impact teams. What does an impact team stand for? Impact team is information mobilized for performance analysis and continuous transformation. Our work in impact teams started around 2010 when we instituted quality improvement teams for community case management in Malawi, Rwanda, and Ethiopia. And during that time, our implementation research in Malawi specifically showed that while all districts had access to the same data, it was those districts with the quality improvement teams that met regularly to review their data and to problem solve that had better performance. So those teams were obviously having an effect on that data and the decision making with that data. So learning from this experience, we further developed the approach and expanded its use in another number of countries. Impact teams, just to give you some more background, it can be established within a specific facility or supply chain level or across levels in the supply chain. For example, impact teams in Indonesia have been formed in each district and province where we work. They meet monthly within each level, but then each quarter the province and the district meet together. When an impact team is first established, a team develops its mission and identifies a set of supply chain indicators and targets for improved performance for those indicators. As seen in the cycle here, each time the team meets, they use data to evaluate their performance indicators. They identify problems and causes and plan actions to take between their meetings. And I'm going to say a little bit about what's common across impact teams is no matter what country or program, they all have an information management system that provides supply chain data for performance monitoring. They all have the common goal of improving supply chain performance and product availability. They all have leadership at the national or subnational levels to support the teams to overcome their more complex problems. They all engage in performance monitoring using data to identify problems and monitor progress towards targets. And they all use a recognition system. This is really important. The recognition system to reward those who have improved performance, those facilities and levels that improve performance. And they also engage in peer-to-peer learning for motivation. They all do problem solving using structured approaches to identify root causes and local solutions. Do action planning that track the outcomes of the meetings, and they also track their actions they're taking and who's responsible. And they all hold their meetings regularly. This is an important part of this approach, is that they meet regularly to use their data to this problem solving. And that those regular meetings connect staff from different levels in the supply chain and throughout. So far, JSI has implemented impact teams in 10 countries and across several program areas. So we're now going to start sharing some of our experiences in implementing impact teams in several countries. And I'm going to start by asking some questions of my colleagues. Tessemae, when we talk about impact team approach, we often say that data availability and visibility is not enough to improve supply chain performance, and that we need to create a data culture. So when I use the term data culture, what does that mean to you, in particularly in Ethiopia? What are you talking about when you talk about data culture?
Okay, thank you, Barbara. So we have seen what impact teams are, the levels that they can be operated, and how they are evolved through time. So based on this, data culture means it's a teaching culture, which means it's the practice of data use, as data is defined as explicitly considering data in one or more steps in the decision-making process, which in turn leads to action. So this is basically a continuous activity. It's not one-time activity. That's why how we are seeing how the impact teams are operating. So in data culture, it's basically get data in front of people so that people do have access to data for decision making. And it's also to stimulate the demand for data from the grassroots level, which means let people use data as a point of generation instead of preparing themselves to report it. So because as a fundamental objective, the collection, analysis, and organizing of data is just to use it for decision making. So data culture means the integration of people, technology, and process towards a data-driven decision-making process. That's Barbara.
Okay. Siko, what is your perspective on the need for creating a data culture? What does it mean for you in your work in Tanzania and Kenya?
Yeah, thanks, Barbara. So just to add from what Teshome has already explained, so to me, data culture is creating that habit for people at different levels, especially different levels of supply chain, to use data for performance improvement. The status quo in many places like Kenya, here in Tanzania, lower levels, they normally just send reports for higher level to use, but they're also supposed to use the same data for their own performance improvement. So to me, I'll put that way that creating that habit for all levels to use data for performance improvement. Thanks, Bob.
Great. I'm going to share some of my experience in Indonesia and Myanmar. So impact teams have been used in Indonesia as one of the supply chain improvement interventions by the My Choice project, which has been focusing on strengthening data quality and availability and access and use. So there's already a very strong ELMIS in place at the National Population and Family Planning Board, BKKBN, in Indonesia. And there is an overwhelming amount of data, but province and district staff had really no process by which to approach the data. It was almost a paralysis by an abundance of this data, and as well as some mistrust in the quality of the data. So the introduction of the impact teams has provided an entry into the use of data, a process for data use. And by using that data, it's increasing the user confidence and excitement in measuring their supply chain performance. And so this is part of creating a data culture, I think, is building that excitement and really ensuring that there's a process by which to approach that data and use it. In Myanmar as well, one of the things we found is that decentralization has made nurturing a data culture at the lowest level of the supply chain really important. While automation at the service level is very limited in Myanmar, the impact teams that we've been able to introduce empower staff to use their data even from their paper-based LMIS forms to track their performance. And they've really delighted in the understanding between the relationship between their data and their work, and they can see what the results of their work and evaluate their assumptions and perspectives on what is happening in terms of product availability. Tishme?
Thank you, Barbara. So we are saying that the impact teams are successful in bringing data culture or in strengthening in data culture in the supply chain system. So maybe it's worth to talk about the success factors behind that. So what has been the key success factors for the success of impact teams in different countries? Maybe we'll start Barbara and Matiko to follow.
Okay. I think one of the things that makes impact teams so successful in our experience has been that this common goal and structured approach and a standard agenda and the tools that really give the teams a process to go through to really glean what the most important information from their data. So in addition to following the processes that are illustrated in the diagram here, tools such as management diaries that have helped teams document decisions and the actions they take have been really important. In Myanmar, they use simple paper-based tally sheets to track their progress, while in other places, the tools have been more sophisticated dashboards that really help the teams see improvements in the performance. So, Matiko, what are some of the success factors that you've seen?
Thanks, Barbara. So just to add again, some of the success factors including, of course, availability of data itself through systems such as ELMIS, DHIS2 in Kenya, and as we've shown earlier, the processes. So looking at data, doing the root cause analysis for underperformance, coming up with action plans to improve performance, and some of additional factors including data champions, especially here in Tanzania, these are members of the same impact team who mentor others, and of course leadership from the government and also from the established structure. who have embraced this approach, especially in Tanzania. And the other thing is the introduction of dashboards, impact team track dashboards that has helped, especially in Kenya, where instead of just looking at data, the raw data the way it is, but this dashboards helps them to see, to analyze that, and of course see the problems quickly, and can address the real issues, or be able to do the root causes analysis to come up with an action plan for improvement.
Okay, thank you, Matiko. So when we come to Ethiopia's context, we have made significant investments in digitizing the public supply chain system at all levels and for all health programs. So we used different branded products as a tool to manage supply chain data and operation. Vitas, Embrana, Fanos, Import, Dago, all these are operating at different levels of the supply chain system. So this digital activity has improved access to data, and as web-based dashboards are designed and considered the levels of the types of data needed by users, all these are important for the impact teams to get real-time data access to supply chain. The other success factor behind impact teams in Ethiopia's context is end-to-end supply chain data visibility. So, as I said, we are using interoperable tools which are used by the regulatory system, the supply chain, the EPSA, which is the supply chain, the government agency which is responsible for distributing products across public health facilities and the health facilities. So from the health facility level to the regulatory, we do have interoperable tools. So these digital activities are one of the success factors for the impact teams. The teams are getting data whenever they need to measure supply chain performance, prioritize problems, and prescribe solutions for improving the supply chain performance. So digitization and end-to-end supply chain data visibility can be taken as success factors for the impact teams in Ethiopia's context.
Matiko, you've already mentioned the use of dashboards in some places for helping out the impact teams. Do you have anything else you want to add about dashboards?
Yeah, just to quickly add, there is the analytical skills that need that we have been helping the teams to acquire that skills, because with data, without data, analytical part of data, it's become difficult. So dashboards helps, but also we do coach them and mentor them on additional insights that they can get from the same data or dashboards.
Mm-hmm. Mm-hmm. So maybe I'll add a little bit about what Indonesia has been doing and what factors have led to the success. They're similar to what my colleagues have been talking about. The automation of the data and making that data easily digestible is also been happening in Indonesia with their with a tool that was created. It's a tool that's used for inventory management, but also does the calculation of performance indicators, and the teams can easily see where they are for their performance indicators through that automated tool. When they meet every month, they can see how much progress they've made since last month in improving their indicators. The second thing that has happened, Indonesia, the budgets for the districts manage their own budgets, and they have for budgeting for those impact team meetings has been one of the success factors. They have the districts generally budget for the meetings, and impact team meetings don't really cost very much. There may be just refreshments or transportation for the meetings, but having that budget for impact team meetings has helped to make them more regular and has contributed to the success for those meetings at the province and district level.
And also to add, one of the things that we've learned as a success factor is They need to involve or operationalize impact teams at a level where members have an understanding of root causes. They are close enough to the problem and are empowered to make those changes. So our initial engagement in Kenya, we started impact teams at county level, but we quickly realized we need also to introduce impact team at sub-county level, which it helps to improve the results and performance because of the thorough root cause analysis that can be done with the members from sub-county level. And in Tanzania, just to add, we have also implemented impact team up to facility level. So whereby within the facility, the team sit down together and look at their data and do the root causes to come up with actions to improve availability of commodities.
Great. So far we've been talking about success factors such as using the ability to have automated tools that help visualize the data more easily. We've talked about having impact teams at all levels of the system and at even those lowest levels in the system where root causes can and local solutions can be identified. Another factor that makes impact teams successful is also having a real mix of skills on the impact teams. Successful teams can include members from across functions and levels in the systems, and also all different responsibilities, nursing officers, pharmacists, medical officers, as well as storekeepers. I know I've talked with Teshome and the Ethiopia teams, they have quite a few different people in the team, including at the hub level, the hub managers, they have the forecasting and capacity building team leader, lab officers, supply chain partners, vaccine supply officers. So across programs, across different kinds of responsibilities, and bringing a range of skills to the team, as well as those people that are committed leaders. Another thing I wanted to share was one of the success factors in Myanmar has been quantifying the amount of money that has been saved because of the actions of impact teams. So impact teams in Myanmar have been able to identify stock imbalances, overstocks and low stocks by looking at their data and facilitating transfers of stocks between facilities. And they've estimated in southern Shan State that they have saved as much as $175,000 a year in the savings from product loss due to expiry because of the ability to transfer stocks based on the use of their data in the impact teams. Another success factor for teams is the opportunity for peer-to-peer learning, and I think I mentioned this a little earlier, is one of the things that all teams should share, and this informal capacity building that takes place during meetings. People want to participate in impact teams because they feel like they're building their capacity.
Okay, so despite the success that we have seen, there are always some challenges. And I'd like to ask my colleague, I'll start with Teshome, what have been the challenges and how have they been addressed in Ethiopia? And then we'll go to Barbara.
Okay, thank you, Matiko. So as a challenge, I think conducting a regular meeting is one of the challenges for some of the for some of the teams in Ethiopia. So some teams are not conducting the regular meeting due to competing activities in members' organization. The impact teams are composed of members from different organizations like the IFSA, which is the Ethiopian Pharmaceutical Supply Agency, regional health bureaus, zonal health departments, and partners. So any of the competing priorities in any of these organizations may delay meetings in some of the teams. Of course, some teams are also missing some of the meetings. The other is some teams are not working with their full potential to execute planned activities that are planned to address priority issues, supply chain issues. So I think these are the major challenges in Ethiopia's context. So to minimize the effect of these challenges, we have supported the teams to prepare an annual schedule that's shared at the beginning of the year for all team members, and all members are strongly advised to stick to that schedule. The other thing, or the other efforts that we did is we have also provided leadership training for the impact team leaders and top level of the management to support the teams to execute the plans they are planning at the time of their meeting. So with these efforts, we try to minimize these challenges. And I hope in the future these leaders for the teams and these schedules will just minimize the effects of missing some of the meetings in some teams.
Thank you, Teshome. Barbara?
Sure. As this quote on the slide says from Indonesia, staff turnover is a challenge, as it is in all aspects of health programs these days. And one of the things that the impact teams have done and BKKBN has done is really documenting the processes and establishing a mentoring system that really helps new staff get up to speed when we do have this staff turnover. Consistent, as you know, Teshome said, the consistency of routine meetings can be a problem. One of the things we've seen is, of course, competing activities, but also a sense that you can't hold a meeting unless everyone is present, everyone in the team is present. And that's generally not, it's not necessary to have absolutely everybody present, but, you know, to have enough people present in the meeting to hold the meeting. So changing that culture of meeting everyone to saying, oh, we have enough and we can go ahead with the meeting even if everyone is not here. That's been a bit of a challenge. In terms of the competing priorities and making sure the meetings happen on a regular schedule in Myanmar, one of the things that has helped, particularly at the facility and township level in Myanmar, is linking product distribution to the team meetings. So facility staff come into the township to pick up their products. At the same time, they'll have their impact team meeting with the township staff as well. So they'll have that cross-level meeting at that time, and that has helped streamline and also ensure that things happen while they're in while the facility staff are in the township picking up their products. Matiko, what about Kenya or Tanzania challenges? What are some of the challenges you've been seeing?
Yeah, so for Kenya and Tanzania, they're almost also the same. There's competing priorities, which has been a challenge, scheduling the meetings and ensuring there's a consistency in members to meet. And of course, there is also sort of like dependence to partner support, especially financial and technical, to have these meetings. But some of the interventions or the ways that we've tried to overcome this is one, of course, encouraging the impact teams to set aside a calendar for the meetings, so that the meetings are known and they are not conflicting with other activities that they will have. And also, we have also encouraged the teams, especially council and regional level, to budget a small amount for the meetings, at least for just water, so that the team can be able to meet. And the other last part that we've also helped to overcome some of these challenges is the sensitization of leaders at the county, regional level, and of course at the central government, especially in Tanzania, where we've encouraged leaders to seek progress and reports from the teams. And these teams, especially in Tanzania, they're supposed to report, share the minutes with council, district executive directors, and regional administrative secretaries in Tanzania. And at the central level in Tanzania, staff there, or we have this PORAG called President Office Regional Administration and the local government. They usually ask quarterly reports and updates for the teams from all the regions that are implementing impact teams. So in that way, it helps to ensure the teams are meeting and also implementing this approach as it's supposed to be.
That's great, setting that expectation at the higher level too, that they'll see the results of the impact team. That's a great way of reinforcing having the impact teams meet regularly. Another question for my colleagues here and is, so what evidence do you have that using the impact team approach has improved supply chain performance and helped to ensure that family planning products reach women when and where they're needed? Teshome, let's start with you. What evidence do you have that they've been effective?
Okay, thank you. So maybe in the next slide. So as depicted over the slide, after the impact teams, we has designed and implemented in Ethiopia, the number of dashboard users and sessions have been increased over time. We have been suffering low number of users and sessions for our web-based dashboards. So we designed the teams like late June or early July. So after the teams are designed, for the number of users and sessions have been increased. So this suggests that the teams are fostering the use of data for decision makings. And maybe for in the next slide, we did an assessment of use of data by teams or hubs, which includes about people, process, and technology. And this shows increased data use for after the teams are designed and placed in the hubs. So as you see, the light blue is before the impact teams. That means the level of data culture in terms of people, processing, technology. So after the teams are designed, the assessment shows an increase in people, processing, technology aspects of data culture. So this is also one of the indicators that impact teams are improving data culture in Ethiopia's context. Maybe in the next slides, we try to link this effect in terms of supply chain performance indicators, KPI indicators. So as you see, wastage rate is always below the target set by the Ethiopian Pharmaceutical Supply Agency. So these teams are contributing to the improvement of the KPI. And maybe in the next slide, you can see product availability within the EFSA system. That means excluding the facility. So products, these tracer products are available 100% at all times within EFSA, suggesting that EFSA can supply any of the facilities at any time when there is a request. And maybe in the next slide, you can see about stocking of products according to plan. So in the supply chain system, the integrated pharmaceutical system that Ethiopia is designed and implemented, there's a min-max system of products. So as you see, though we are low from our target, but there is successful improvements in stocking of products according to the plan. So we believe that the teams have contributed to this improvement. And this is for all products that the Ethiopian Pharmaceutical Supply Agency is managing. But coming to family planning products, also the KPIs show improvements in product availability. As you see, from July to February, there's a successful improvement of product availability within EFSA system. And we believe that also the teams are contributing this improved product availability. So this is for family planning. Maybe in the next slide, you can see the wastage rate of family planning products.
That's the last slide.
Yeah. Okay. So we believe that these impact teams are contributing improvements in KPI in Ethiopia's context, apart from improving data culture, use of data for decision making. So I think these are one of the indicators that impact teams are contributing to the supply chain system of the country in general and the family product availability in particular.
Thank you. We'd like to share a few slides from a cross-country analysis we did on the impact of impact teams. And in each country, we found non-intervention areas to compare with the intervention areas and looked at several indicators before and after the introduction of impact teams. This particular slide is for stockouts of contraceptive products. So Matiko, you want to go ahead and share Kenya and Guinea, and then I'll talk about Indonesia and Myanmar.
Yes, sure. So as you can see, if we start with Guinea, the stockouts from areas where there was non-intervention and areas comparing with areas where the impact team was implemented, there's a significant difference. And also comparing pre-intervention and post-intervention, there is also a great reduction of stockouts across all commodities. And in Kenya, with as you can see also with the exception of injectables, where there were some issues beyond impact team intervention, the other commodities, the stockouts were reduced comparing with areas where there was no intervention.
Mm-hmm. Great. So in Indonesia, with the exception of implants, the percentage of facilities stocked out of contraceptives in the intervention areas after the introduction of impact teams decreased, as seen in these dark blue bars as compared to the bright blue bars. So we'll see stockouts have decreased in those impact team areas, and certainly the stockouts are better than in the comparison areas, which are those dark gray bars. And we see the same impact in the Myanmar situation. We'll move on to the stocked according to plan. And as you all know, stocked according to plan is going to be defined by the specific country max-min system. And when we want to see, what we want to do is see more facilities, obviously stocked according to plan after the introduction of impact teams. And in Indonesia and in Myanmar, we do see that the comparison between the dark blue bar, which is the post introduction of impact teams, as compared to the bright blue bar, and also in general, not always, better than the intervention areas. And we see that impact in both Indonesia and Myanmar. Any observations about Kenya and Guinea?
So in Guinea, across all commodities, there was a much improvement. More facilities were stocked according to plan for all commodities, and of course for the areas where they were implementing impact team had a better outcome than the areas where they were not implementing. In Kenya, at ward level, again with the exception of injectables, which was the reason behind impact team, but the rest of commodities, there were improvement in number of facilities stocked according to plan.
Thank you. This slide shows some more specific data from Indonesia, from the My Choice project. It shows not only the reduction of stockouts and increase in adequate stock levels in My Choice areas, so where impact teams have been implemented. So the impact teams are in the My Choice districts as compared to the rest of the country. And it shows that a difference, obviously, a higher number of adequately stocked facilities and a lower number of facilities that are stocked out in those areas that have impact teams. But it also shows that over time, the improvements that have a result of the introduction of impact teams. We stopped supporting impact teams in Indonesia in early 2018. So those impact teams have, with the budgeting, with the expectation of meeting, they have continued to improve their performance even beyond the support of the project into 2019. So we're very pleased to see that. This data comes from their electronic LMIS, so independent of our data collection. Some other results that we're seeing from impact team meetings are things like improved data quality, reducing overstocking, improved capacity amongst the team members, increased budget for supply chain activities, and a real enhanced value. It brings focus onto supply chain as an important aspect of the family planning program and to ensuring that products are available. In Myanmar, we have some data specifically for Southern Shan State where we see improvements. In Myanmar, impact teams are called quality improvement teams. So we see an increase in reporting rates, an increase in stock adequacy, that green line, and a decrease in the stocks out rate, which is this lower blue line after the introduction of impact teams. Another thing that we see, many of the actions of the impact teams in Myanmar are also, this is for Mandalay State, are actually the rebalancing of stock levels, taking product from overstocked facilities and moving them to understocked facilities as a result of the quality improvement team or impact team review of the data. So this just shows that after quality improvement teams started, that the number of transactions, this other upper line, is the number of transfers of stock to improve stock balances. So that's quite a few transfers of stock. And then the lower line is the number of products that are involved in those transfers. Out of 38 reproductive health products, there are quite a few that have been involved in the transfers. It's just showing that impact teams have made a difference in rebalancing stock in Myanmar. Additional benefits of impact team approach include obviously things like team building, improved coordination and communication across programs and in all levels of the systems. Tika, I'm going to turn it over to you.
Yes, sure. So other additional benefits with the impact team, they encourage innovative solution for solving supply chain challenges. Some of which they are like there are some like late reporting or later submission of orders. So impact teams at different places and sub-county level came up with innovative solution to use WhatsApp groups and WhatsApp as a platform for reporting and coordination, and of course also creating tools and SOP to support better reporting processes. So one of the incidents in Kenya is for some of the areas where network is not good, so people used to take photo of the report and then go to a place where they can at least get connection and send that via WhatsApp, and the people at the council level, they'll enter that into the system and the order would go for processing. So the impact, generally the team impact teams approach encourage that, because whenever they do root cause analysis and they want to come up with feasible solution and something that they can be able to implement at their own level, then all those different innovative solutions can be applied. So just to move on, I have another question with to my colleagues. So we have had a range of experiences applying impact team approach in diverse contexts and across various supply chain. What are some of the characteristics of your country context to which your approach was adapted, and how has the adaptation contributed to the adoption, scale, and sustainability of the impact team? I'll start with Barbara.
Okay. Well, you know, just like you were mentioning in the Kenya situation and so forth, in Indonesia, the creation of the use of WhatsApp groups and also Facebook groups to follow up on actions and to recognize good performance has been an adaptation. And the WhatsApp groups have developed some friendly competition and also are almost a helpline as well when impact teams have some questions that they, a problem that they haven't found a solution for. They'll put out a call to ask, see if other teams have had similar kinds of problems. So they'll use those WhatsApp groups for support and for also as a recognition of performance. Some adaptations in Myanmar really have including membership to the team, to programs beyond the reproductive health programs where they first focused, but making involving other programs in the impact teams, and that has led to actually the adoption of impact teams by other programs, including the malaria program and other programs in Myanmar are beginning to use impact teams as they've seen it work in reproductive health. And that's been an adaptation that's been interesting. And also by including other programs which may be in a sense more valued by the senior management, that gives some more credibility to the reproductive health impact teams. So another thing is, I think we heard this from Ethiopia earlier, is this addition of leadership training for the team members. So that's adding that a bit of training after the teams have gotten organized and they're starting to function, but giving them that extra boost with leadership training has made the teams more effective and kept them energized. So those have been some of the things that have been happening in Indonesia and Myanmar. Anything? Okay.
Okay. In addition to what Barbara said, most of the teams do have a Viber group to share information in addition to the web-based dashboards. So in this group, they share some of new arrival products. Sometimes they take also information from web-based dashboards and post it to their Viber group for extra sharing of information. Telegram is also used by the impact team leaders network for sharing experiences, challenges, because a challenge in one team can be a solution for another team. So this can be taken as some of the adaptations in Ethiopia's context. We have also managed to provide data use and dashboard training for the team members with the objective of understanding the theory of change for data use, identifying data sources for their dashboards, and to be aware that anything they can do on the tools could result in data quality. We have also managed to capacitate the necessary skills on data analysis, interpretation, verification. We have also, in this data use training, we have also tried to show them how the insights, how to use these web-based dashboards for their routine decision making. And as previously Barbara said, we have also managed to provide leadership training to the impact team leaders with the objective of just to capacitate the leaders to describe their role, how to just build a successful impact team in their hubs, to identify characteristics of high performing teams and what a leader can do and the likes. So in addition to this, we have also developed tools such as impact team management dashboard. We're on the way to construct this dashboard, which is a web-based dashboard also that shows the performance of the teams in terms of the selected impact team performance indicators. So the dashboard is also, this impact team management dashboards will also provide information for the impact team leaders and the top level management units of the agency on how to support the teams accordingly. So I hope this will contribute to the sustainability of the teams in Ethiopia's context. Matiko.
Thanks, Teshome. So just to touch a bit what motivates the team to continue beyond that, I think the recognition of the good performance, also I would say the satisfaction that team usually they get when they are able to solve their own challenges, and being empowered by data and additional analytics that additional insight that they get through data that they have. I think those are some of the things that motivates the team to continue beyond the initial establishment. Barbara, anything to add?
Okay, so talking about what motivates these teams to keep going, in Myanmar, motivation has been supported in a number of ways, but some of that motivation is that's the whole recognition system that the team puts together during the initiation of the team. And the recognition system in Myanmar usually includes a certificate or a small gift as a reward for improved performance. So that's helped a lot. And as I mentioned, the WhatsApp group in Indonesia and creating that bit of friendly competition has also improved motivation to keep the teams going. Sustaining motivation beyond that initial intervention, though, is often dependent on the leadership and finding the right champions early on in the introduction to the approach and nurturing those leaders to help motivate the teams to keep their keep going and to keep meeting and to really see it. But and also that peer-to-peer learning is a part of the motivation to keep going. I know in Ethiopia you all have actually sort of trying to measure some of this motivation and so forth. And what motivates the teams in Ethiopia to keep it going and to keep improving their performance?
Okay, thank you. So in addition to what colleagues said, in Ethiopia, the improvements in KPIs as members of all the impact teams access to these dashboards, then the change in KPI, the improvements that we showed, I think this also motivates teams. So perhaps in those stage rates, stocking according to plan, product availability, all these KPIs are getting improved after the design of impact teams. So the team members will just value their activity because they can just understand that they are doing right by just seeing the change in KPIs over time. The other is, as you guys mentioned, the recognition activities given to the teams, and team members is also motivating the teams to move beyond the project implementation periods.
Great. So just to wrap up, we're getting close to the end of our hour here. So moving forward, what's next for impact teams? As we move beyond 2020, we need to employ adaptable, innovative, and evidence-based approaches to strengthen reproductive health supply chains. So I'm going to ask my colleagues, how do you think impact teams will evolve and continue to contribute to stronger supply chains?
Yes, so just to contribute on that, what we've learned is that there's no one cup fits all. So not only one design of impact team can fit everywhere. So what we've learned is to use human-centered design to come up with different prototypes. We've come up with 3 prototypes: basic, intermediate, and advanced, depending on the level of the technology, data, people, and leadership that the country or region they have, and then implement those different types based on those contexts. So we'll be doing that, supporting implementation and adaptive learning in Kenya and Tanzania. And we hope at the end of the day, we'll be able to develop these packages and be able to replicate that or share those packages with other partners and other countries to adapt them and implement based on their own context.
Great.
Back to you, Barbara.
Thank you. Teshome, actually, I want to ask you, what are your thoughts about impact teams beyond 2020?
Yeah, okay. So in Ethiopia's context, I think the impact teams will continue the approach to improve data use culture in Ethiopia. So these teams will take advantage of the Federal Ministry of Health of Ethiopia of transformation plan. In the transformation plan, one of the pillars being information revolution, and this will be attained through improving data use culture in digitization. So I hope impact teams will remain the approach to bring data culture with different information systems. The other is with the development of theory of change for data use. I think the impact team's approach for data use will remain foster the integration of people, process, and technology that can lead to more responsive and predictive supply chain systems. I think that is.
Great. So in summary, impact teams are people-centered and data-centric. The approach provides structure that allows for creativity and innovation in solutions that have resulted in supply chain improvements that include improved product availability, coordination, collaboration, better communication, and improved data quality. The solutions impact teams come up with are most effective when the approach is adapted to the local situation and sustained through purposeful recognition and cultivation of leadership. We look forward to being part of the evolution of impact team approach as we move into the next decade to ensure that quality products are available to men and women when and where they are needed. Thank you for being with us today. And I don't know if we have time for a few questions. I think I will turn it back over to our organizers to see if there are going to be any time for questions here.
Thanks, Barbara. Unfortunately, we're at the top of the hour, so if there are questions, you can send them in. Folks, if you want to send them in or type them into the chat box, we can perhaps answer some of them by writing to send back out. So thank you, Teshome, Matiko, and Barbara. This was a really informative webinar, and thank you everyone for joining, and hope you have a great week.
Thanks, Ellen. Bye.
Thank you. Thanks, everyone.
ምን ያክላት እንዳደረጉ እንግዲህ እሱን ኢምፓክት ይሄ እኮ ግን የአርኤችሲስ